And Ansley's cooking up a healthy meal with a doctor at Baptist Health. Good Afternoon, Arkansas starts now. Well, we could all use a new healthy recipe to add to our dinner rotations. Today, Ansley is live over at Baptist Health, where she is cooking alongside a bariatric surgeon, and we will have more from her coming up a little bit later on in the show, so don't miss that. Just ahead, Ansley is live inside a kitchen over at Baptist Health. Ansley, tell us what's coming up next.
Okay, Alicia, I'm so excited. We were making a fresh summer dish. It's a chicken lettuce wrap, and we've got Dr. Paul making it right here, but we'll show you how it's done after the break. Stay with us.
Well, we are learning a new recipe today from a bariatric surgeon at Baptist Health. Ansley is helping him in creating a chicken lettuce wrap. She joins us live now. Ansley, how do you begin over there?
Okay, so Dr. Paul has already begun with the chicken and several other ingredients, but we're making this because this is something that one of your patients can actually eat, correct?
Oh, absolutely. Yeah, this is something that that's pretty easy to digest. It's not too bulky, it's not too stringy, and the way that we're making it here, it's not very spicy. That's something that some of our patients really don't tolerate very well. But we're trying to make this to kind of show people that even after one of these surgeries that we do for people, they can still eat pretty regular food, pretty normal food.
So how did we get started here, and what do you want me to do?
Okay, how about make the sauce for me here? We've got that sesame oil. We've got some rice vinegar. We've got some hoisin sauce, which is kind of like a, almost like a Chinese ketchup. Here, yeah, use a spoon, get some of that in there. And we got soy sauce. About a quarter of a cup there. We got some honey, about 2 tablespoons of honey.
I'm guessing you're just going to mix the chicken with the sauce, correct?
Yeah, and we're going to add some vegetables here in a minute.
Oh, yes.
Yeah, so that's cornstarch. So that's kind of a, yeah, so that's kind of an emulsifying agent. So give that a little stir. And then, there you go.
Already smelling so good.
Yeah, man. So we're going to get, we're also going to get this fun little cap on, and we're going to shake this up kind of like a salad dressing.
Okay.
Let's be very, very cautious so we don't get things everywhere.
Who would be the best candidate to come and get one of these surgeries?
Well, the people that qualify for these surgeries are people that have a BMI that's greater than 35 with a comorbid condition like high blood pressure, diabetes, reflux, things like osteoarthritis, or a BMI greater than 40. And so basically, yeah, go for it. So basically, our patients are people that have been overweight for some time, and they're really kind of getting just really tired of being overweight and dealing with all these medications that they're having to take daily. So it's something that everybody has to kind of reach their spot where they're tired of fighting with their own weight.
And are there 2 different types of surgery when it comes to gastric bypass?
There's multiple types of bariatric surgery, but here at Baptist we just do the sleeve gastrectomy and the gastric bypass. So far, and we're starting to do another surgery called a duodenal switch, but these 2 surgeries work very well for our patients, and you know, they can meet the needs of just about every single one of our patients that come see us.
Okay, well, hey, in just a little bit, we're going to put this all together, wrap it up, and of course, we have to try it.
Try it out, absolutely.
All right, Alicia, that's coming up next.
All right, it looks delicious. Wish we could smell it from here. Thanks, Ansley.
So let's see.
Okay, not only is this man a surgeon, folks, but he can also garnish a dish. What did we create today?
Well, this is a ground chicken lettuce wrap, and we've got garnished with a little bit of cilantro, a little bit of green onion, and some peanuts. If you wanted it spicy, you can put a little sriracha or something else to kind of give you that heat. But like I said, for our patients, typically the less spicy, the better.
Sure, because you're a bariatric surgeon, like we were talking previously, and this is something that your patients can normally eat. It's just, it has good flavor to it. But we'll have this recipe up on our website, so if you want to make it at home, you can too. Thank you so much for showing me how to do this.
Absolutely welcome. Absolutely.
It's been absolutely
Thank you very
delicious.
much.
This is one of your favorite things to make for the summer? Or do you have other favorite meals?
It is a very good summer meal. I make it for my family, and they seem to enjoy it too. So, yeah, we'll continue doing it.
Smells good, so good, and there's a community virtual cooking class coming up that people can participate in as well.
Correct. Yes, through our Baptist website, they'll be able to participate in these communal cooking classes, kind of just show some different recipes and different ways to look and think about food.
So good. Well, I'm going to finish eating this. Alicia, toss it back to you. This is good.
All right, it looks delicious. I'll have to try the recipe he made. Thanks so much, Ansley.